About an hour and a half west of Atlanta in Anniston, Alabama, the Centers for Disease Control has set up a mock ETU, an Ebola treatment unit. Fake patients in a fake hospital. So in an actual Ebola treatment unit, there is somebody watching you,
yep.
and there is a mirror so you can watch yourself.
Exactly, and so there's also a partner who's watching you, that because you never go into the center by yourself.
But this isn't the CDC's protocol. This ETU was designed by Doctors Without Borders, a group of volunteers that is basically running the international effort to contain Ebola. In Anniston, Americans are training before they go to West Africa.
So, one of the focus points here is to show that your white part is your clean part.
So
that's something, right now we're all clean, but this is something to remember when we're taking it off.
You're only touching white.
Exactly.
Suiting up is only a small part of the training. Doctors Without Borders has learned that to keep their own volunteers safe, they don't just need a suit. They need a routine with military redundancy, and they need an architecture that moves them in one direction only.
You are now going to be entering the high-risk zone. The reason the arrows are here, it's a physical reminder that it is one-way flow of traffic from here on out.
You're always moving in the same direction, less danger to more danger. Okay. From clean, you move into suspected. This is an area where patients are waiting for test results. They all have symptoms, but only some of them have Ebola.
Sometimes an ambulance pulls up with 10 people in the ambulance. They've been bouncing for 2 hours down the road. Somebody might have died in the ambulance, and the other one was just thrown as for who knows why.
You've been in one of these units in West Africa. This is a very high-stress area. As a healthcare worker in 95-degree heat, you can't spend more than an hour in the suit, but you're not done. The hardest part of moving through an ETU is getting out.
You're going to use aseptic technique to remove the gloves.
Okay.
Trying as deliberately as possible not to splash anything, and just nice and slow.
Okay, so the principle here is you start with the dirtiest thing and work your way to the cleanest thing. Removing the suit is much harder than putting it on. It's the time when the risk of contagion is highest.
Not touch your skin. You don't want to touch your skin at all. You're going to stay more towards your chest. Slide across the chest like this.
That part right there, putting your gloved hands inside and actually touching the scrubs, is terrifying. I can't imagine doing that 3 times a day.
It's really a mindset that requires confidence with your teammates and clear communication.